Atmung begleitet uns jede Sekunde unseres Lebens. Das meistens, ohne dass wir dem besondere Aufmerksamkeit schenken, oder? Dabei beeinflusst die Art unserer Atmung tatsächlich unser Nervensystem, unseren Schlaf und damit unsere Leistungsfähigkeit. Umso mehr freue ich mich, heute einen besonderen Gast zu haben, dem international bekannten Atemexperten Patrick McKeown, der auch mein Vorwort geschrieben hat. Das freut mich sehr. Patrick ist der Begründer von Oxygen-Advantage. So heißt sein gleichnamiges Buch und auch seine Trainingsmethode. Er ist der Direktor und Erfinder von der Buteyko Clinic International und Autor mehrerer Bücher. Die Bücher hat er über funktionelle Atmung geschrieben. Eins heißt, wie gesagt, Oxygen Advantage. Er hat auch The Breathing Cure geschrieben, ein Standardwerk, was ich jedem empfehlen kann. Gibt es auch auf Deutsch. Und sein neuestes, worüber wir auch sprechen, ist The Breathing Cure for Better Sleep. Er beschäftigt sich damit, wie wir unsere Atemmuster verbessern können, Schnarchen, Schlafapnoe und Schlafqualität verbessern können. Wir alle Betroffenen kennen den schlechten Schlaf, den wir haben, und er gibt uns Tipps und Tricks, wie wir das vielleicht verbessern können. Wenn ihr anschließend noch tiefer einsteigen möchtet, dann können wir uns gerne noch austauschen und ich lade euch ein, in meine School-Community zu kommen. Den Link findet ihr unten in der Beschreibung. Jetzt wünsche ich erstmal viel Freude bei meinem Gespräch mit Patrick McKeown. Viel Spaß!
Long Covid, Long Story. Der Podcast für Menschen mit Long Covid, ME/CFS, Fibromyalgie und Postvac. Über das, was im Körper passiert, über den doppelten Kampf um Anerkennung und über Wege zurück ins Leben. Mit Dr. Claudia Kanitz.
Thank you very much that you are here. Our topic today is breathing and the connection to long COVID and chronic fatigue. My first question, why breathing matters in long COVID and chronic fatigue? Many people with long COVID and CFS have the experience of persistent fatigue, reduced energy capacity, exercise intolerance, and PEM, this post-exertional malaise, change in breathing patterns, dysregulations, and sleep disturbance. Question for you. What happens in our breathing pattern after a serious viral infection, and why do many people notice changes in their breathing?
I think with any stress, and a serious viral infection is going to be a stress in the body, but it's also going to be a stress in the mind. Because if you're an individual who has had a fulfilling life and you've done okay in your occupation and family life and your personal life, and then all of a sudden that's taken from you, that's going to generate a lot of stress and anxiety, and our breathing changes in response to that. So I don't think it's a coincidence that a lot of people with ME, with chronic fatigue syndrome, with long COVID, that they have underlying dysfunctional breathing patterns. Now, you might ask the question, well, is it the anxiety component of ME and chronic fatigue that's feeding into it? Is it the condition itself that's feeding into it? So what's causing what? And nobody really knows. And it's only recently anyway that there's going to be some recognition on this, even though we would have seen it over the years, but it was never 100%. One researcher wrote about it Leon Shato, back probably about 20 years ago. And if I can remember correctly, he was talking about that dysfunctional breathing in ME and in chronic fatigue syndrome, of course it wasn't long COVID at the time, is very common. And it comes back to this, is it that the condition is changing breathing patterns, but what is the abnormal breathing pattern doing to the condition? So there's going to be feedback. And a more recent study looking at ME and chronic fatigue syndrome, if I can remember correctly, is between 60 and 70% of that group have dysfunctional breathing. So it's high.
I remember you mentioned the sentence that we are all breathing too much. So what's your key message within that sentence?
I don't know if we're all breathing too much, but I think it's common. Over-breathing is pretty common. Yeah. And it depends on what pockets of the population that you look at. So when we talk about dysfunctional breathing, people might be wondering, well, where is over-breathing in this? Well, over-breathing, chronic hyperventilation syndrome is the same thing. So over-breathing just means that you are breathing a little bit too much air every minute, every hour, every day, that the volume of air that you're taking into your lungs is in excess of what your body needs. In a similar way, it's, you can compare it to overeating. People know straight off what overeating means. eating too much food for what your body needs. Well, overbreathing is breathing too much air for what your body needs. And it's not just that you're breathing faster, because it's not just the respiratory rate that determines how much air you breathe, but it's the number of breaths per minute multiplied by the size of the breath, the volume of the breath that determines the air that you breathe. So it's common. I know it's reported, say, for example, in the anxiety population, it's 75% of that population. In severe asthma, it's as high as 50%. In the general population, a Cochrane review said it was 9.5%. I think it's higher. See, it all depends on how do you measure it, and what are you assessing? Like one paper in the Journal of Strength and Conditioning Research looking at athletes concluded that 90% of athletes, regardless of age and regardless of whether they're amateur right up to professional, 90% of them have dysfunctional breathing. But they assess dysfunctional breathing using the high-low test. Other researchers will look at dysfunctional breathing by using the Nijmegen questionnaire. And that goes back to a 2013 study, a Swedish study, looking at exhaustion syndrome and hyperventilation. They looked at 35 individuals. They had them complete the Nijmegen questionnaire. And if you score over 23 points on the Nijmegen questionnaire, it's a validated questionnaire for assessing hyperventilation syndrome. And those individuals were 26 or 27 points. So clearly, it's suggestive that they have hyperventilation syndrome. And it was right across the board. And then when the researchers looked at addressing their chronic hyperventilation, their symptoms of depression, their symptoms of fatigue reduced. So there's a case that address abnormal breathing and you help dampen the stress response, you help bring balance to the nervous system, you help improve the person's sleep, but you also help improve their recovery. Because how can you recover if your breathing pattern is in such a way that it's continuously feeding into a fight or flight response? Because so much of your resources are mobilized just to deal with that. And there's not going to be so much then left over to actually help with recovery. So we need to be kind to the body and we need to look at, something as like long COVID, etc., it can really, really knock that person for six, meaning that their energy levels are low, their reserves are very low. Of course, there's going to be an anxiety component to it. There's no question. There's going to be a lot of rumination, which would all tie in with that. So that's where breathing can help.
Yeah. I have to consciously remind myself again and again and again to have the right breathing pattern. So in your courses, we are learning to breathe correctly. Can we speak about the correct breathing pattern? So diaphragmatic breathing is one of the topics. So we had the topic in our dental clinic where we begin to teach young children not to breathe through the mouth. So nose breathing is such an easy tool, but nobody knows. So let's speak about the difference of breathing techniques.
Sure. I suppose we're just going to normal. What's normal breathing? Normal breathing is how we should have been breathing anyway before various factors influenced it. And it starts off with the nose. I think the nose is so important in dentistry. Nasal breathing is so important, not just for young children with if they have the mouth closed and the tongue is resting on the roof of the mouth, it helps with normal craniofacial growth, but also across all ages in terms of oral hygiene. I spent a couple of months putting together a PowerPoint presentation, look at the impact of mouth breathing, persistent mouth breathing on oral health. Because if the child or teenager or adult is breathing through their mouth for a period of time, of course, saliva in the mouth dries up. The first thing about saliva is that it helps to wash away, it helps to wash the food particles from the mouth, and it clears them out of the mouth into the gut. And that in turn then helps to reduce the risk of dental cavities. But it's not just about that. When the mouth is dry, it also alters the bacteria in the mouth. So there's an increase in the diversity of bacteria in the mouth, which is not necessarily a good thing. It's not like the gut. And then when the individual is swallowing every time they swallow throughout the day, they swallow that bacteria from the mouth into the gut. So there's translocation. Another aspect then is that the pH of the mouth, it decreases. And once pH drops below a certain point, I think it's 5.5, that erosion of teeth becomes more prevalent. Halitosis, bad breath, is influenced by the child, teenager, or adult persistently mouth breathing. So just even with the nose, I only honed in on dental health here because, the conversation that we're having here. But it's so important for dentists to start realizing this, because there must be a lot of children, teenagers, and adults who are presenting at dental clinics. And the dentist is noticing that these individuals don't have good oral health. And I think too often that the dentist is thinking, well, they're eating too much sweets, or for example, they're not brushing their teeth adequately enough, or they're not flossing. And, how
But
many
it's the
dentists are
mouth
asking the
breathing.
question, how are you breathing?
Yeah.
And then the question might be, well, is it about breathing during the day? Well, the patient might say, well, I'm breathing
My
through my
next
nose all the
question.
time. I have my mouth closed during the day. But the person could be doing a lot of physical exercise. There they have their mouth open. Runners don't have good teeth. Okay, you might say it's due to drinking sugary, high energy drinks. But, I think aside from that, the fact is that if you're running a lot with your mouth open, your mouth is dry and it changes the environment in the mouth. And then, of course, sleep. 50% of adults wake up with a dry mouth in the morning. That would be our own observations. This is all a very understudied topic. It's very understudied in terms of the nose to the mouth. But if we just look at what the physiology says, look at what the nose does. The nose does a lot that the mouth doesn't do. And even just honing it down to dental health, there's huge implications of the importance of nasal breathing versus mouth breathing.
Yeah, that's exactly the next question. Why does breathing influence sleep? Of course. And when we are sleeping with an open mouth, it's even worse. That's why I recommend your myotape, for example. So breathing and sleep, the final connection. Especially many long COVID patients or chronic fatigue patients are suffering or struggling with poor sleep, of course. So it's not a topic with us. It's a great focus in your new book, The Breathing Cure for Better Sleep. So what simple steps can people start at home to improve their sleep, especially when they are struggling with?
I think when it comes to sleep, we have to think about three things. We have to think about the nervous system. If we have hyperarousal, so, it's difficult to know when we feel stressed. I might ask the question, well, do you feel stressed? How do you know if you're stressed? What do you weigh it up against? What do you check in? And one of the first things that goes haywire when you're stressed is your sleep. You wake up during the middle of the night, you have difficulty falling asleep, or you wake up too early. So there's three things there. Okay. If there's something on your mind, it can be difficult falling asleep because you're thinking about it and you're twisting and turning. If you have hyperarousal and you're thinking and worrying about something, you can wake up at 2 or 3 o'clock in the morning. And it's challenging then because here you have a very time that you need to have all of your faculties, especially your cognitive function. There's a difficult situation. There's a situation that you want to be able to be at your best, but the situation is overpowering and it's causing you to be worried and to be anxious over the situation. And then you're not at your best to be able to deal with it. So the nervous system is very important, and the nervous system will be very important because I'm sure when you look at people with ME and chronic fatigue syndrome and long COVID, that there's dysregulation of the nervous system, that it's not in balance. So breathing plays a role there. The second thing is the airway. We want air to flow from the nose into the lungs and back out again very easily. We don't want air to be struggling. We don't want difficult breathing in terms of the air coming in through the nose or in through the mouth. And, there's a resistance to breathing, meaning that it's quite difficult for that air to get from the nose or the mouth into the lungs and back out, because if there's an increased effort to breathe, that can take us out of deep sleep. And also, if the resistance to breathing, in other words, the difficulty for that air to travel from the nose into the lungs and back out again, it could cause airway collapse. So the airway itself, the part, the throat, it might be that the soft palate is falling back into the throat, or the tongue is falling back in, or the epiglottis is falling back into the throat, or the throat itself collapses. And if the throat itself collapses, well, then air can't get in and carbon dioxide can't get out, and the person is stopping breathing. And at some point, they're going to arouse from deep sleep. Now, they may not be conscious of it, but at the same time, they've been taken out of deep sleep, out of slow wave sleep, stage 3 sleep, into lighter sleep. So they're going to wake up feeling that just not adequately refreshed. And then snoring, of course, as well, nose versus mouth snoring. So we talked about the first one was hyperarousal. It's very important to look at the nervous system. The second one is the airway itself. Are you helping to open up your airway? And if your mouth is open and the tongue is in a low resting posture, that's automatically going to narrow the airway, making breathing more difficult. And you don't want that. So that's where we want the tongue resting up in the roof of the mouth, which can only happen when you're breathing through your nose, and the mouth closed with the lips together. And also with the mouth closed and the lips together, the lower jaw is forward. So it's helping to open up the airway. And the third factor then is breathing patterns, because how we breathe during the day is going to influence how we breathe during sleep. Because even though it's very understudied, but Messino was one of the first authors to look at that connection. He looked at high loop gain, unstable breathing during sleep apnea. And he mentions that, yes, your breathing during wakefulness. Well, you can assess your breathing during wakefulness to get an indication of how you're breathing during sleep. And he used breath whole time. So I think there's a huge connection, between our everyday breathing patterns and our breathing during sleep. It's very understudied, but again, it's just based on the normal physiology. And I'm currently co-authoring a paper, a review article on mask leak in sleep apnea, which is a big problem. So a CPAP machine, for example, is the gold standard of treatment for people with sleep apnea. And, it was designed really for the nose, wearing a nasal mask. But sometimes the air comes in through the nasal mask and it comes back out through the mouth. So it's not actually doing its job. It's called mask leak. And then the person is prescribed a full face mask. But the full face mask, the person then may have their mouth open with the full face mask. Their tongue is in the low resting posture. Their lower jaw is back. So now the CPAP has to work harder to get the air in through the nose and in through the mouth, because the mouth open posture is narrowing the airway. So for the nasal mask, or for the CPAP to work, you have to increase the pressure. And when you increase the pressure, it's uncomfortable for the person. It increases the risk of mask leak. And the person then is less likely to stick with it. So yeah, there's just, I think nose breathing versus mouth breathing, makes so much common sense, and so many people have felt a difference with it. And I do understand concerns that doctors might have. We're not about forcing nasal breathing. That's not what it's about. It's about assessing the person can breathe through their nose, child, teenager, or adult. It's about bringing in good breathing practices during the day, and also getting the mouth closed during sleep. And that's where myotape comes in terms of a tape that comes around the mouth but doesn't cover the mouth. So it's quite unique in that, and it was designed that way.
I think there are certain topics which are important for a good sleep as well as for a good breathing. So that was exactly my topic in my dental clinic. I was a tongue-tie surgeon, and I know how important the correct position of the tongue is, and good nasal breathing pattern. But what I wanted to mention is I remember that in your recent course, you explained the default network mode and the flow. I think that's very, very important, and also a bridge between long COVID and neuroscience. Can we speak about the default network and some connection for recovery?
Yeah, in terms of there's a couple of aspects though that are quite interesting. There's new research coming out as well from the University of New Mexico, and it's looking at glymphatic drainage. I remember reading years ago with people with chronic fatigue syndrome that one theory was that their glymphatic system wasn't working the way it should be working, and the lymphatic system as well. So the lymphatic system is, of course, the body's way of helping to clear the accumulation of toxins. But the glymphatic system is linked with the lymphatic system, but the glymphatic system is in the brain. And normally the brain cleans itself during deep sleep, during slow wave sleep. But if you have an individual and they have insomnia, or if they wake up quite easily from sleep, or if they have sleep apnea, or if they have upper airway resistance syndrome, which is a topic as well that often gets overlooked, and it's more prevalent in women than in men. So upper airway resistance syndrome is when there's an increased difficulty to breathe. And that increased difficulty to breathe takes the individual out of deep sleep. But the brain doesn't clean itself as readily because sleep is impacted because there's not enough time spent in slow wave sleep. So researchers of New Mexico have started looking, this was it's only come out in the last few months. Could you mimic the glymphatic system that happens during sleep? Could you mimic it during wakefulness? And it was based on carbon dioxide. So one theory is that by doing breathing exercises or by inhaling carbon dioxide into your lungs, Now, bearing in mind that carbon dioxide is produced in the body anyway. So by increasing carbon dioxide for a little period of time, for a short period of time, that causes the blood vessels in the brain to dilate. And then you go back to normal breathing, the blood vessels narrow, they constrict. And then you increase carbon dioxide again and the blood vessels dilate. And then you go back to normal breathing and the blood vessels constrict. And it's the dilation and constriction of the blood vessels that is causing the movement of cerebrospinal fluid through the brain. And that's what's helping to flush out the accumulation of toxins. Now, one very simple way to help to increase carbon dioxide is to hold your breath. Now, of course, with chronic fatigue and ME and long COVID, we can't do breath holds that are that long. So it might be a 5-second breath hold. Now, a 5-second breath hold is quite short. Will it be enough to have an effect? I don't know. Most certainly 20 seconds would be enough. See, you want to have a breath hold, but you don't want to stress the person out either. So you want to kind of keep the nervous system in relative balance while doing the breath hold itself. But I just think that's one aspect that should be very interesting. And the research with that is more so looking at Alzheimer's and Parkinson's disease. But we're talking about the brain, we're talking about the nervous system. So it could have implications as well with ME. And it's something anyway that we would always recommend with people with chronic fatigue syndrome. You know, doing a gentle breath hold and doing them little but often throughout the day. And that might have been one of the reasons that it could be helpful, because as you breathe in and breathe out and you hold your nose and you count 5, 4, 3, 2, 1, you let go, but you breathe in then. You know, during the breath hold, you will have a slight accumulation of carbon dioxide in the lungs, which in turn is going to increase it in the blood. Now, is 5 seconds of a breath hold long enough? I don't know. That's the question. So anyway, it's emerging research. The other aspect then is with the DMN is also emerging research when it comes to breathing, because I think breathing now is getting attention where it didn't get it in the past. So the default mode network is, well, researchers a couple of decades ago, maybe it could be 3 decades ago, they were analyzing the activity of the brain, and they had individuals in scanners, and they were asking these individuals to focus on the task. And when the individuals focused on the task, parts of the brain lit up. But then when the individuals didn't have to focus on the task and just went into kind of mind wandering, the parts that lit up during the task-oriented focus, they quietened. But other parts of the brain lit up when they went into mind wandering. And the researchers then started to do more studies on this. And then they concluded that when you are in rumination or mind wandering, in other words, that you're just kind of sitting there, you're stuck in your head a little bit, it doesn't mean that the brain is doing nothing. It means that there's activity going on in the brain, but it's not the same regions of the brain that would be associated when you're focused on the task. So they call these regions, the mind-wandering regions, they call them the default mode network. And it's a number of different regions in the brain. And there's 2 aspects there that are important. One is the activity. You don't want too little activity, but you don't want too much activity. You know, you don't want to have too much activity going on in the default mode network, or too little, because that will affect your mental health. And the other thing is the connectivity between the different regions. So you want to have normal connectivity and normal activity. And carbon dioxide does seem to play a role there as well. Now, a lot of the experiments would have been laboratory experiments where the individuals were breathing in carbon dioxide. And it's different when we're doing breathing exercises because we don't get the same concentration of carbon dioxide when we do a breathing exercise. But there's another couple of interesting studies, I think, by Yang, and they had individuals breathing in through their mouth or breathing in through their nose, and they found that when the individuals were breathing in through their mouth, that the parts of the brain associated with speech lit up. And of course, speech is analytical and speech is thinking, you know. So there's something definitely in terms of the default mode network with regards to breathing patterns and carbon dioxide and nose breathing, that there's a couple of things going on there. One is that the nose is directly communicating with the brain anyway via the olfactory nerve. And there is definitely an influence on the rhythm, brain rhythm, as a result of nasal breathing versus mouth breathing. And that's been looked at over the last 5 years. And then the second one then is carbon dioxide. You know, what does carbon dioxide do in terms of the connectivity and the activity of the default mode network? And I think it's really promising. You know, it's again, it's relatively new, it's emerging research. And you might say, well, see, we're not just reliant on carbon dioxide here either, even though carbon dioxide is physiologically very important because we can increase blood flow to the brain directly by simply changing our breathing patterns. And it's not by taking the full deep breath. When we think of the brain itself, it consumes 20% of the oxygen coming into the body, and also about 20% of blood flow goes from the heart to the brain. So the brain is very heavily reliant on both blood flow and oxygen. But if you have an individual who is in chronic hyperventilation, meaning that their breathing is just a little too fast and too hard, that in turn can lower carbon dioxide. And when there's a lowering of carbon dioxide, the blood flow to the brain is reducing. And when blood flow to the brain is reducing, and the loss of carbon dioxide, which in turn increases blood pH, that contributes to increased brain cell excitability. And increased brain cell excitability, again, there's a hypothesis by a psychiatrist called Michael Binder that the brain then is like a broken record. So he was saying that we need to look at a different paradigm in terms of mental health. We need to look at the brain cell excitability. That when there's increased brain cell excitability, it's feeding into mental health issues. And then we have to ask the question, well, if it's increased brain cell excitability, that's the problem. Well, how do we have to reduce it? It's been known that carbon dioxide plays a role with this since the 1930s. And one paper by Balestrino and Somnium that was written back in 1988, and Dr. Andrew Huberman was talking about it in the last year or so, they said that the brain, by regulating breathing, controls its own excitability. And when we think about the brain by regulating breathing, what does that mean? Well, it's, people talk, well, take a full deep breath if you're stressed. That could be the wrong thing. That could be absolutely the worst thing you could do. If you're stressed, don't take full deep breaths because you could be blowing off too much carbon dioxide. And that's going to increase your blood pH. That's going to reduce blood flow to the brain. It reduces oxygen delivery to the brain. That's not what you want. We need to be thinking about the opposite. We need to be looking at the opposite.
Wow, that's such a great knowledge and overview about the science. So I can recommend everyone to have a look further to your latest book. I think The Breathing Cure is one of the general books everyone can follow with. And I see a connection with breathing, breath, and the neuroscience. So we can use it as an instrument for self-regulation. And I think small practices in the daily part can create some recovery without pressure or wrong expectations. So that's why I put in small protocols within my book. And I know you have online a lot of exercises and even audio meditation. So I can recommend that, especially for sleep. And I hope we can continue this conversation in person. Probably I can come and visit you in Ireland. And thank you very much to have written my pre-word. I know you have a lot of appointments, so thank you very much for taking the time. It's a great honor for me. And that's why I hope you say the same in English. I'm taking up my hat for you, or do you say to you? I'm learning vocabulary every day. So thank you very, very much. It's a great honor for me to have you in our show and in the book and in the whole topic about chronic fatigue, because I know myself and I was suffering years, and the right breathing pattern and your books and your exercises are a great value throughout the whole health journey or recovery journey. Thank you for that. So
yeah, and I think just a thing
session,
as well, I think with chronic fatigue syndrome and with long COVID, that we have to bear in mind, we're dealing with a nervous system that can be quite dysregulated, and energy levels, of course, aren't always that great. So the exercise themselves, going little and often, is much better. I've made the mistake with the past with people with chronic fatigue syndrome. I would give them too much exercises or spend too much time doing it, and they had a crash.
Yeah.
And, the issue then is that it can be very demotivating for the person because they feel that, well, it hasn't worked for me, it's made me worse. It's all about kind of calibrating to where we are. And the best way to calibrate something is to start off very, very easy. So even if you start off with a 30-second breathing exercise, and then give it a rest for an hour, and then come back to it after an hour and do 30 seconds again, and then maybe increase it to 1 minute and increase it to 2 minutes, and just to check in your body. And like I think with breathing exercise as well, it's a great way to give ourselves some attention and to be able to do something for ourselves. We carry the breath with us. It's very empowering that way.
So it is.
And there's no doubt that the breath is a great way into the nervous system, and it's a great way into sleep, and it's a great way to influence blood flow and lymphatic drainage, etc., etc. So, there's something definitely in it. It takes a little bit of time. You have to go gentle. You have to calibrate it to where you are. But it's definitely most worth doing. You found that in your journey, and that's something I think that, talking about it and the results that people are actually getting on the ground, especially with long COVID, that there's a potential there that's very promising.
We have a great overview for today and a lot of topics and exercises we can start with. Hopefully see you the next time for a next session or in person. So thank you very much.
Thanks very much, Claudia.
Thanks.
Long Covid, Long Story. Alle Folgen, Fragen und der Austausch mit anderen Betroffenen in der Voices Community. Den Link findest du in den Shownotes.